Hello guys, we are from Group 5 DVM4 and for today we are going to share to you all about plasma protein. Let's learn more. Serum protein fractions can be divided into three. First is the pre-albumin, which may not exist in domestic animals. Second is the albumin, which is 35% to 50% of total serum protein. And lastly is the globulin, which consists of the alpha globulin, beta globulin, and gamma globulin. The major site of synthesis would be at the liver, where it synthesizes albumin and essentially all plasma globulins other than immunoglobulins and von Willebrand's factor. For the secondary major site, it would be the immune system, where the lymphoid system synthesizes immunoglobulins, while megakaryocytes and endothelial cells synthesizes von Willebrand's factor. Plasma protein functions in the structure of cells, tissue, and organs. It also helps in cell regulation. It also aids in transport and carrier, and also maintenance of colloid osmotic pressure. Not to forget, it aids in blood coagulation. And last but not least, it also plays an important role in biochemical reaction. Now, we've come to the topic plasma protein. Plasma protein is the collective term for the proteins present in the blood. Plasma proteins fall into several different groups and have numerous functions. This includes maintaining osmotic pressures and transporting lipids, hormones, vitamins, and minerals. The total protein test gives an approximate measure of all plasma protein. Well, this includes fibrinogen when the test is done on clotted samples. And the typical reference range is between 60 to 80, and the plasma protein will consist around 7% of the plasma and 0.5% of total body mass. Here are the types of plasma protein. There are two types of plasma protein, which is the albumin and globulin. They have different functions. Albumin plays an important role such as providing amino acids for your bodies and stopping fluid leaks. As for globulin, it helps support your immune system, blood clotting, and other vital function. This is the purpose of plasma protein test. The purpose is to measure the amounts of specific proteins in the blood. Total protein levels may be higher or lower than average in the case of certain disorders. And as you can see here, this is the list of possible disorders that may cause the changes in the protein levels. Here are examples of results of plasma protein. And as I mentioned earlier, it can be higher or lower. And usually in cases of higher protein levels, it is associated with bone marrow disorders, infections, and inflammation. However, lower than normal plasma protein levels may indicate severe malabsorption, kidney or liver disease, and bowel problems. And as you can see here, this is the total protein reference range for different types of animals. It differs based on different animals. Now, let's learn about globulin. What is it? Globulins are a group of proteins mainly synthesized by immune system and liver. They help fight infections and transport nutrients. The three types of globulins includes alpha, beta, and gamma. When there is an increase in alpha globulin, it indicates nephrotic syndrome and acute inflammation going on. Meanwhile, an increase in beta globulin indicates active liver disease, suppurative dermatopathies, and nephrotic syndrome. Next, increase in gamma globulin indicates immune stimulation and immunoglobulin production. On the other hand, the decrease in gamma globulin indicates immune suppression and immunodeficiency syndrome. What is albumin? Let's find out more. Albumin is a type of protein made by the liver and regulated by interleukin-1 and other cytokines. Albumin represents 35% to 50% of the total serum protein concentration in domestic animals. Function of albumin includes storage protein, binding and transportation, solubilized lipid-soluble and insoluble substance, and also facilitate liver clearance of plasma constituents. Here are a few examples of albumin half-life in different animals. Cow 8.2 days, sheep 14.28 days, horse 19.4 days, pig 8.2 days, and dog 8.2 days as well. In some situations, there may be a decrease or increase in albumin levels. It is termed as hypoalbuminemia and hyperalbuminemia. The factors are as follows. Now, let's talk about acute phase protein. This segment is a bit long, so bear with me. Acute phase protein are a class of proteins whose plasma concentration increase during the positive acute phase protein or decrease, which is the negative acute phase protein, in response to inflammation. This response are called the acute phase reaction, ACR. Okay, this is the mechanism where the traumatic injury or pathogen will induce and cause cell injury. This will activate the resident macrophage of tissue and monocyte residents in the circulation. After the cells have activated, they will secrete pro-inflammatory cytokine, which includes interleukin-1, interleukin-6, and TNF-alpha. The different pre-inflammatory cytokine acts on different organs. For example, interleukin-1 and 6 will act on the bone marrow. They will function to stimulate the progenitor cell to induce the acute phase protein production. Then, the mature leukocyte will enter the circulation and make their way to the site of injury and phagocytize the pathogen. As for the liver is an important organ where it is the main production organ of acute phase protein, which is triggered by the interleukin-6. The cortisol secreted by the adrenal gland can also indirectly regulate the acute phase protein production. Acute phase protein has both component of pro-inflammatory and anti-inflammatory properties. The both component will travel to the site of infection to promote healing and homeostasis. Now, let's learn how the acute phase protein acts during inflammation. Okay, the first picture shows how a normal circulation is. The second picture shows the margination of leukocyte to the peripheral area near the endothelial cell, which is a response towards the acute phase protein. As for the third picture, it shows the increase of vascular permeability, allowing the leukocyte to penetrate the endothelial cell to migrate to the site of injury to promote both healing and homeostasis. The acute phase protein can be divided into the positive and negative, where during the positive, it increases response to inflammation within the first 2 days. It has both pro-inflammatory and anti-inflammatory properties. The negative APP decreases in response to inflammation within 24 hours. And there are major and also moderate acute phase protein. In the major acute phase protein, there will be an increase between 100 to 1,000 fold, while the moderate APP increases between 5 to 10 fold. The positive and negative APPs will produce different things. Okay, so for example, the positive APPs will produce C-reactive protein, ceruloplasmin, haptoglobin, serum amyloid A, alpha-1 acid glycoprotein, and the negative APPs will produce albumin and transferrin. And this is the major acute phase protein produced in different species. You can see right here, the cat, the dog, the horse, the cattle, and the pig all have different major APPs. The cat has serum amyloid A, the dog has serum amyloid A as well, with CRP, which is the C-reactive protein. All plays a major role. Now, let's head over to albumin to globulin ratio, or also known as A to G ratio. What does it mean by A to G ratio? Albumin to globulin ratio is the amount of albumin in the serum divided by the globulins. The ratio is used to identify causes of change in total serum protein as the albumin plus globulin equals to total protein. So, does normal A to G ratio indicates that the animal is perfectly healthy? The answer is not necessarily. Normal A to G ratio can also be seen in the case of relative hyperproteinemia due to dehydration. Aside from that, this can also be seen in the case of hypoproteinemia due to overhydration, external plasma loss such as burns, and internal plasma loss such as acute GI disease. Here comes the real problems, which is increased A to G ratio and decreased A to G ratio. Increased A to G ratio occur in the case of hyperbilirubinemia. Hyperbilirubinemia occurs either due to artifact of hemolysis or due to hemoconcentration caused by dehydration. Uncommon causes of increased A to G ratio is due to hypoglobulinemia. This can be seen in neonates with failure passive transfer of colostrum. Hypoglobulinemia can also occur due to low production caused by combined immunodeficiency disease. Increased A to G ratio can be compared with other parameters in the hemogram and blood biochemistry results. For instance, in the case of hyperalbuminemia due to hemoconcentration, we may expect increase in hematocrit level. Increased A to G ratio due to hypoglobulinemia is rarely seen without the concurrent decrease of albumin level. Most conditions that cause low globulins are related to increased loss from the body. Therefore, there will be concurrent decrease in albumin level as well. Next, decreased A to G ratio. This can happen due to hypoalbuminemia. Hypoalbuminemia occur either due to decreased production and synthesis by the liver in the case of chronic liver disease or due to maldigestion and malnutrition. Another factor causing this low level of albumin is due to increased loss of albumin due to protein-losing nephropathy and protein-losing enteropathy. Aside from hypoalbuminemia, decreased A to G ratio can also happen due to hypoglobulinemia caused by infection, inflammation, or neoplasia. The decline level of A to G ratio can be further related with other findings. For instance, in the case of hypoalbuminemia due to the liver disease, we may expect an increment in the liver enzyme and also hyperbilirubinemia. Hypoalbuminemia due to small intestinal disease, we can expect to see low or high folate and decreased cobalamin. For hypoalbuminemia due to kidney disease, we can expect to see an increase in the BUN and creatinine level. Next, in the case of low A to G ratio due to hypoglobulinemia, we may compare the result with these findings to further confirm our diagnosis.
Thank you for watching this video. We hope you learned something about plasma protein today.